Hello and welcome to Let's Talk. My name is Olujo Kemosaku, and as usual, we bring exciting topics, interesting topics that are educational, topics that will actually open our eyes to see the things that are happening around us, things that, events that we can't help, but they are happening, and we need to forge ahead with it. So that's why today we'll be talking about migration of health workers, from developing countries to high income countries. And basically, this is actually a focus on Africa because lately there's been a lot of migration from these health workers going across board to for greener pastures. And I know that it's been a whole lot of headache, even for governments across Africa. That's why I have with me Dr. Kunle Ashimi. He is the NMA chairman, Ogun State, Nigeria. So he's here to discuss that with us, and I would appreciate if you can actually follow us accordingly. And before we continue on this program, I'd like to remind you, as usual, to please subscribe to our YouTube channel, follow us on all of our social media platforms, and please share this video as you watch. Thank you. Thank you so much, Dr. Kunle Ashimi. It's nice having you here.
Thank you so much. Thanks for having me.
All right, so the topic for today is migration of health workers from developing countries to high income countries. Now, my first question is, like I said in my introduction, that the rate of migration from health workers health workers have greatly increased. And with that, it's actually going to give the health institution in such country a degrading strength. So with this, I would like to ask you why it is so. Why is it that health workers are the ones migrating so much?
Thank you so very much for that question. But let me lay a premise. While I'm talking, and you should understand something, migration of labor is a growing concern all over the world. Just as we are talking about doctors and other health workers living in Africa or Nigeria, you also have a lot of British-born Britons, as well as British medical doctors, who are also living in droves. So when we talk of the reasons, one of the things that comes to mind is remuneration, and you see that as relative. What would make a British doctor to leave Britain and then migrate to maybe countries like Australia and other places because of poor pay? That same pay is a lot for the average Nigerian doctor and is not jumping at it from other African countries. So that brings me to one of the reasons is that the average doctor, when you graduate, in our own setting, you can be in America and go to the university, graduate a doctor with government loan. A lot of Africans cannot, Africans, where do you get education loan? So you have your parents having to borrow, sell their properties to send you to school to become a doctor. And so when you graduate, one of the things that is expected is that you'll be able to maybe pay back and then help them to catch up with the lives that they have lost because you had to go to school. And when you see yourself failing at that, you want to go somewhere where you can make enough to make sure that your parents enjoy the fruit of their labor before they die. So a lot of people are living. More so these days, they are living earlier than in the past. The other reason that would actually or that actually has been a major reason for people migrating is job satisfaction, the ease of carrying out our activities. You know, some of us read about some equipment only in school and we never see them in practice, even as small as they are sometimes. As such, when you come to the crossroad and you have to carry out certain procedures and you cannot have them, you rather improvise if you can, and in some situation you cannot. So you have a lot of mortalities on your hand. And when it, as a doctor, you get back home at the end of the day, you audit your day, and then you start telling yourself, oh, that man should not have died, that woman should not have died. Only if I had this, only if I had that. And that is becoming too much, for you as you go on. You would want to move to the climes where you can get better results for your skills and all that. Thirdly, is that there is this propensity for the public to heap the blame of a system that is not working on the people that they come face to face with, particularly the doctors and nurses and probably some other health workers. And so the security of lives of health workers at work is a very big issue. You beyond the fact that there are many hospitals that don't even have fences and any way of securing the health worker when patients sometimes die, especially where you find that the doctor or the other health workers are helpless, their helplessness could stem from the fact that somebody has been ill for several days, weeks, or months. And these illnesses are the ones that, would, if not taken care of, end in death. You find people going first to the chemist shop, to herbalists or spiritualists, to churches and some Islamic clerics who claim to have wherewithal to heal them, and they are in that condition until it gets so bad that it's irreversible or almost irreversible. Or where it's going to be reversible will cost a lot, and that is when they remember to come to the hospital. And when they get to the hospital, they don't even have money anymore. They've spent everything that they had, and eventually, when maybe the patient dies, the fault is heaped on the health workers, and you have them being assaulted verbally, physically. And so when it has happened to you once or twice, and you know that you are putting your best, and then this is what you still get, then you start looking for the way out. Now, fourthly, this is one of the domino effects that we see, the fourth one. I usually tell people that the more people leave, I mean, the more doctors leave this country, the more doctors that will leave. Why is this so? It is so because if you have a place, in the first place, Nigeria has never has never employed enough doctors to take care of the population. Never. Now, even in the midst of that, doctors are still able to work. Let's say like 10, 15 years ago. All of a sudden, in a center where you need 30 doctors and you have 10 people managing to do the job of 30, two or three or four now leaves. You're leaving six people to do not the job of 10, but the job of 30. And they get tired, they get fatigued, burn out, and all of that. And the moment a doctor gets burn out and he continues to work, the probability of making mistakes, medical errors increases. And of course, we find doctors who collapse, on the job and die from there. So when this happens, you realize that now six of you are trying to do the job of 30, and the bureaucracy of government would not allow that replacement to come. By the time you start shouting that you need this replacement, it takes several letters, several months after. By the time the bureaucracies approve that maybe two other persons be employed, then two people has already left again. So by the time the two other persons are coming into the system, they will meet only four, and the number goes back to six. And it continues like that, such that people get tired of the system and they have to leave. So I say that the more doctors that leave, the more that will leave, because those that are left behind are overworked. And this gives room for, of course, more medical errors. And when this happens, their lives get in danger because people will heap up all the blame on them. I think I will stop here now.
Now, with all that you've mentioned, actually, I was also going to ask the driving factors, of which you have mentioned a couple of it. With this, I would like to try. I want us to separate the African continent from the world over. While you were talking, you talked about the government should be blamed, not the health workers if there's anything wrong. But in these other parts of the world, they have all of those things. The government are particular about their people, and they are really, doing everything possible to ensure that health is really getting the best out of it. Now, how do we relate that with a government who is not, who doesn't see anything, who is not doing the best they should when it comes to health situation, and a government who is pro to making sure that healthcare is top notch? How can we compare that migration?
You see, like I said, for those whom you find migrating from those countries that we want to say are developed, are well-to-do and are supposedly, or which the Africans believe pay more money in those countries, it is relative. I was talking to a friend who is a doctor in the US, American born, American trained. And one of our lamentations is that she still has over, say, 200 and something $1,000 to pay, as the loan, that she took to go to school. And that in itself is taking a big toll compared to, having to pay her monthly bills, having to take care of herself and all that. So find herself walking over and over and just paying, bills and trying to repay. And the fear of having a loan hanging over her head is not a good thing for her at all. So just imagine that she finds a place where after working for 2 years, she'll be able to pay those loans back. Maybe that will make her come back to the system. That is on the hand of those countries where we believe that the government is doing enough. There's some money in there, but it's a relative thing for the African. Okay, what the doctors in the UK and the US are looking at as small is actually humongous, it's gigantic for an African whom, if I go to the UK and I make £1, if I send it back home, it's also about 1,800 naira, which can do a lot more, So for the Africans, essentially, I think that when we look at governments, priorities are actually misplaced. And I believe that a lot of African leaders don't understand the importance of health. They see it as social service, they see it as intangible, just as they see education. A lot of them don't understand that any country that wants to develop, the people must be educated and the people must be healthy. As such, they will then have to put a lot into that system. But rather, what you will find, of course, there is a lot of deficit in Africa anyway. There are deficits of roads, deficits of bridges, deficits of electricity, and so many, even we have pipeline water, a lot. And so, for them, health is intangible. No, people don't see, except you just come and build a hospital in this empty space, and people will see that there's a hospital. And people say, oh, government has built a hospital. That is the structure. How about the function? Are they ready to employ the appropriate number of the different health workers that are going to be there and the ancillary services? Are they ready to provide the equipment and the appropriate running expenses, capital expenditure, and all of those operating expenses and all of that? That will make that place standard. After all, one of the problems we have in Africa, particularly in Nigeria, is the level of entitlement that we have been made to grow over the years when, government has been seen as the Father Christmas. Every governor that comes in wants to put in one story about free this, free that, particularly health and education. Good health care service is not cheap. So when a governor declares free health, and the only thing that is available as either substandard drugs or just paracetamol, and every other thing they have to go and buy, the people becomes enchanted, and then they start accusing the health workers of stealing drugs and all of that, drugs that were never provided in the first place, just because the politicians have said we are making free health. So the priorities of most African governments does not include standard health, does not include standard or competitive educational system, because they see it as social service and not something that actually develops the economy. They are looking at roads, they are looking at bridges, they are looking at building some stadiums and all of that. That is some of the problem. So if the African governments, can actually understand the impacts of good healthcare service and good education, Africa will change.